Welcome to the Cancer Doctor Podcast. I am your host, Robert Carrillo. Today, we're going to be discussing the gut health's critical role for cancer patients that are receiving immunotherapy at this time. So this topic is going to be very important for any patient that's been diagnosed with cancer that's either thinking about receiving immunotherapy or is currently receiving immunotherapy at the present time. Our guest today that's going to be discussing the topic with me is Dr. Jamie Waselenko. If you're not familiar with her, we released a podcast last year where we discussed how a conventional oncologist translated, if you will, into an integrative oncologist. And I think you'll find that podcast really fascinating. But to give you a little bit of a background on Dr. Jamie Waselenko, she's the founder and medical director of the Cincinnati Integrative Oncology and Functional Medicine facility. Her patients call her Dr. Jamie, which is what you'll hear me calling her today. And she has over 28 years of clinical experience as an oncologist. She sees patients with all types of cancer diagnosis. In addition to that, what makes her very special is she is going to know some things as an integrative oncologist that your conventional oncologist does not know. They're just simply not educated about. So that truly makes her unique in her position. Some other highlights. Dr. Jamie proudly served in the military for 17 years in the United States Army, and we thank Dr. Jamie for her service. And she attended medical school there while in the military, and she served military personnel as well. She's a fellow of the American College of Physicians, and she holds a professional associations in the American Society of Clinical Oncology, Alpha Omega, Alpha Medical Honor Society, the American Society of Hematology, the American Academy of Anti-Aging Medicine, and the Institute of Functional Medicine. After completing her military service obligations, Dr. Jamie joined the research team at Sarah Cannon Research Institute and Tennessee Oncology. Furthermore, she helped develop a leukemia program, and she led a team to create a new stem cell transplant program. And while there, she became the clinical director of the Sarah Cannon Blood and Marrow Transplant Program and the director of the leukemia research at the Sarah Cannon Research Institute, which is known as SCRI for any of you looking this up. Dr. Jamie's also conducted research, and she has publications that are focused on leukemia, lymphoma, stem cell transplantation, and acute radiation syndrome management. She's left private practice to start her own telemedicine, which she does today, and she assists in the care of patients with hematology, other oncology patients with complex illnesses, etc., that are in need of services that are remote in nature, where she can hop in and help them. Dr. Jamie, thank you for coming back. We didn't scare you off the first time. You're kind enough to return. I want to thank you for doing so.
Thank you, Robert. It's an honor and privilege to be here. And I am humbled that you would ask me back to share some of what I think is critically important for our patients. So I do want to, as we begin to talk about this, I did want to just remind you that during my awakening, I found that I had a gut health issue that was the cause of a 20-year battle with a skin condition that could not be addressed by conventional means, right? So that was part of my awakening. In that process, I saw a naturopath who diagnosed my gut issues, which ultimately led to my recovery of my skin condition. And this reinforced the need that I needed to learn how to get to the root cause of someone's health issue. And so began my journey into functional medicine. So I'm one of the few conventionally trained medical oncologists that also has functional medicine training, right? And I'm in the process of finishing my certification through the Institute of Functional Medicine. But I think that unique combination allows me to see things on the landscape that I was never able to see before, right?
For sure.
Yeah. So kind of wanted to share that with you.
No, that's fantastic. Thank you for bringing that up, because it's one thing to talk about a theory, something that's, it's a theory to us, right? But you've experienced it. You're a practitioner. You've actually put this to work in your own physical body and you've seen the results. So thank you for laying that out there for everyone that's watching this. So let me ask you this, Dr. Jamie. What do integrative doctors mean when they say the gut, or let's say the microbiome? Because, when I think of the gut, I'm thinking about this lower region of my stomach, right? Or my intestinal tract. And microbiome, as I understand it, is part of what's going on down there. But from your uh, from what you've learned and what you know today as an integrative oncologist, what does it mean when we say the microbiome, for example?
Robert, that's an excellent question. Before I answer that, I'd like to start by saying that we are fearfully and wonderfully made. And what I mean to say is that the way that God made us is the way that we're supposed to be. So, for example, we're supposed to have acid in our stomach. We need enough acid to activate pepsin. This acidic chyme then leaves the stomach and gets into the small intestines, where it triggers bile and pancreatic enzyme release to further digestion. So it's just an example of this beautiful balance and why it's critical that we have stomach acid, which we'll talk more about here shortly. But to get back to the question, what is the gut microbiome? The gut microbiome is the community of over 1 trillion microorganisms, including bacteria, fungi, viruses, and other microbes that live primarily in the large intestines. It's an important point to note that there needs to be balance in these microbes. There are typically normal commensals, and there are other communities of bacteria that can become opportunistic pathogens if imbalance occurs. And when balance is lost for whatever reason, we call that dysbiosis. That dysbiosis can lead to inflammation, leaky gut syndrome, immune dysfunction, as well as frank disease, even far removed from the GI tract. So the key functions of the gut microbiome include, but are not limited to, aiding in digestion, further metabolism of nutrients and nutrient absorption, detoxification, production of neurotransmitters like GABA and serotonin, important for our mental health. There is a gut-brain connection, which I'll briefly talk about. The gut microbiome helps with metabolism of certain hormones. It's important to note that the gut microbiome actually breaks down some of our fiber, prefibrotics in our food and form what are called short chain fatty acids. These are critically important to nourish the gut lining. So when we're not taking in enough fiber or enough of these prefibrotics by eating real whole foods, we could actually be causing leaky gut syndrome and immune imbalance and dysbiosis in our gut. It's important also to realize that 70 to 80% of your immune system surrounds your GI tract. So if you are developing dysbiosis and leaky gut syndrome, that can lead to exposure of your immune system to multiple food antigens, for example, especially if you're maldigesting food and the lining is been breached, meaning leaky gut. So let's talk just briefly. I just want to make sure people are aware that what goes on in the gut affects your entire body. There is a gut-brain axis, a gut-thyroid axis, a gut-skin axis, a gut hormone axis. There's basically an impact on every organ system and what's going on in the gut. So it's important, and that cannot be overstated. It's important that people have a healthy gut microbiome, and that gut microbiome is going to support keeping them healthy. So it's important to remember everything that's making us sick is making our gut microbiome sick, whether it's stress or lack of sleep or crappy American diet. Those influences can have a negative impact on our gut microbiome. And our gut microbiome is critically important in keeping us healthy. It's also an important stimulator of our immune system. So I just want to reinforce that this is important in general health, but it's critically important for those patients receiving cancer treatment, especially immunotherapies.
Okay. I want to, it's my habit to repeat back for clarity's sake and to make sure the audience is understanding this, because this is what you just described to me is very powerful. I want to ask this clarifying question. When we say gut, are we talking the intestines, or are we really saying microbiome? Are these synonymous terms, or are they two separate things?
So usually when I'm talking about the influence, so I'm really talking about the gut microbiome in the gut,
Okay.
right?
Okay. Got it. Okay.
Okay.
So when we talk about gut microbiome, then we're talking about the location you said where there's like 1 trillion microorganisms.
It's like another organ, literally, the
Another.
size of another organ. So,
Okay.
so, so we don't want to kill our microbiome with antibiotics, right? Or toxic food,
Okay.
right? We want to nourish it.
Okay. And the reason these microbiomes, which are like bacteria, good and bad bacteria, they need to keep a balance in our gut is because they facilitate nourishing our bodies in a multitude of ways, also influence our hormones or the endocrine system. But then you said something really amazing. There's a connection with the brain. There's an influence of mood. Our mood is actually influenced by gut microbiome. And I'm sure we'll talk about that maybe a little bit more later. But that, right when you said that, I thought, oh my gosh, so what I'm eating is going to influence my mood because of gut microbiome.
Exactly.
Yeah,
Exactly.
maybe food can depress me or maybe make me happy. Um, wow, do I have that correct?
Yes, but I
Okay.
would say, so one of the things we didn't chat about, and maybe we're going to, the gut microbiome also helps us detoxify, right?
Okay.
It's helping to break down substances. The other thing is it can have an anti-cancer effect.
Okay.
So certain bacteria within the gut can be very powerful in that anti-cancer impact, especially with certain cancer therapies. So that's why this is so important. And it's so underappreciated in conventional medicine,
Mm-hmm.
right?
Okay.
We throw antibiotics at people all the time and don't recognize that we could be decimating their good bacteria, right? And causing worsening imbalance. As an example, or we could be putting patients on a medication that's going to decimate and completely alter their microbiome, like proton pump inhibitors, which I'm sure we'll talk about shortly.
Okay. All right. That's a great place to start out. And I did jot that down. 70 to 80% of our immune system is in our gut microbiome. So we're talking the main
Surrounds our
surrounds
gut.
gut.
Yeah.
Yeah. So this is the major player here. Without it, I'm going to get sick, is what this amounts to. So when we were planning to have this podcast, our discussion was that there are patients that have been diagnosed with cancer that are being placed on immunotherapy treatments. But if the gut microbiome is is not right, then the immunotherapy may not be beneficial. So how does the gut support or harm immunotherapy treatments? What is happening there?
So excellent.
In layman terms, right? Because
You might have to pull me back a little bit.
right, okay.
But let's talk about what's immunotherapy, right? And people don't recognize this, but if you're having an allogeneic bone marrow transplant, you're having a major immunotherapy, right? Your entire immune system is about to be replaced. So CAR T cells, right? These are, it's an important form of immunotherapy. And oftentimes people getting these types of therapies, allogeneic bone marrow transplant, CAR T cells, right, which is a wonderful advance. These patients often have had relapse of their malignancy. They're at very high risk of having future relapse and progression. Their ability to respond to that immunotherapy becomes critical, right? And so there's lots of data that continues to grow that suggests the I'm going to use the word gut. It's easier saying than gut microbiome, but the gut microbiome has a great influence. The more diverse the population is, the healthier it is before and after a transplant, the better the outcomes. If you have better gut diversity once you've recovered from your transplant, you're going to have less graft versus host disease and more likely to survive it. Just as an example, there was a recent report of people getting what's called a fecal microbiota transplant, which is basically stool, healthy stool from a donor that's given to the patient. So again, it's getting to the repairing their gut microbiome through a different mechanism, that it could recapture responses in people getting CAR T cells. So I throw those out there because those may not be traditionally thought of as immunotherapies. Immuno-oncology has really exploded. So in many cancers now, we're using antibodies that are a form of immunotherapy. The common example, they're called immune checkpoint inhibitors. Medicines like Opdivo or nivolumab is another name for it, Keytruda, pembrolizumab, Tecentriq, atezolizumab, and the list is growing. So there's actually a lot more than that. But these are considered immune checkpoint inhibitors. And we know there are reports of patients failing their immune checkpoint inhibitor and finding in their gut microbiome that it was abnormal and there was low amounts of akkermansia, that healing that gut microbiome, getting that akkermansia to come up, was able to recapture immunotherapy checkpoint responsiveness. So that's huge, right? Huge. And it is proof of concept that the gut is so paramount in our ability to be able to respond to our therapies, to potentially lessen toxicity of the therapy. So the influence of our gut microbiome cannot be understated.
You said something that really caught my attention. You said acromantia. I believe that is that the correct pronunciation?
It's Akkermansia muciniphila.
Okay, that word.
Yes, no worries.
So you said when they found that it was compromised in patients, the immunotherapy they were on was not effective or as effective as it could have been. Did I hear that correctly? That's one question. The second question is, what is that? What is acromantia?
Acromansia.
Yeah.
It's an AKK. It's two Ks. So
Okay.
so but it's not just Akkermansia, right? There's information out there. There's also a couple other bacteria,
Okay.
and the right answer is not running out and getting yourself on Akkermansia, right?
Okay.
The right answer is maybe investing a little bit to see somebody just to have your gut microbiome looked at, because there are different ways that we can actually nourish the microbiome to get the Akkermansia up and to stay up. But also oftentimes when that's awry, if that's low, there may be leaky gut, there may be low immune function in the gut called secretory IgA, there may be pathogens that are rising. So that it's a sign that the whole gut probably needs some adjustment and work to help it heal.
Okay. So to summarize what I'm hearing, you highlighted some some treatments that sometimes people forget are really immunotherapy, like bone marrow transplant, right? As an example. You mentioned checkpoint inhibitors, but if gut microbiome isn't healthy, it will undermine these therapies, the success of these therapies. Is that a fair statement? I mean,
Yes.
okay.
Yes.
All right. So,
Emphasis added. Very, very important to recognize that.
wow. So in conventional medicine, an oncologist maybe putting a patient on these immunotherapies, not giving any time, or is simply not aware of the value or the role that gut microbiome is playing in all of this. Patient's gut microbiome is not right. The treatment is failing. The treatment is not successful. It's not doing what we were hoping it would do. All the while, it's because we forgot to address gut microbiome. Is that correct?
That is correct. I guess, so one of the things I want to bring out here is the medical oncologist is doing something very important for the patient. They're doing the best that they can for the patient, right? And unfortunately, and I was among them 5 years ago, right? I had only been taught part of medicine. So there was all of these important pieces that I really was blinded to. For whatever reason, I was blinded to them. But there's so many things that I consider low-hanging fruit that the oncologist could do that could potentially help this process. And some of it is easy as education on things like you pointed out earlier, your lifestyle, hugely important, right? What we eat is matter. I tell all our patients, food is foundational. We can't help you if you can't change your diet, right? A good water source, which has to be filtered, right? Mineral add back, sleep, exercise, lowering the toxins, everything that's making us sick is making our gut microbiome sick, right? So anything we're doing to clean all those things up, we're eating real food. We're doing 9 to 15 phytonutrients a day, 3 cruciferous vegetables, right? Which is what we tell all our patients. All of those things are going to give the gut microbiome the nourishment that it needs. So that's part of that process. The other thing is there are other things that are important to help the gut microbiome. For example, vitamin D levels. Patients aren't getting those checked. They need to be having those checked. Vitamin D needs to be in the 60 to 80 range if they're not on, as long as they haven't had calcium issues or calcium kidney stones. They have to be on vitamin K2 with that. They have to be on magnesium with that. There's some basic accoutrements that really need to go with that package that also helps nourish that gut microbiome and have an anti-cancer effect. The reality is your oncologist, as good as they are really likely only going to follow the NCCN guidelines, right, which is a national guidelines, and that is what insurance companies pay for, and they're greatly limited by time, right? They may only have 10 minutes with you before you have to go back for your chemotherapy. So they really don't know if you're sleeping, what kind of food you're eating, what your vitamin D level is. Are you taking in enough fiber, which is hugely important, right? So one of the things, we have a blog on our website that talks about how fiber is very anti-cancer. It helps bind toxins, it lessens insulin resistance, it lessens inflammation, it feeds the gut microbiome, it helps make sure you're taking out the garbage every day so you're not reabsorbing toxins. So I say this because the oncologist part of this is important, but it is so limited for whatever reason, and time is one of their big limits. So I think patients that have cancer diagnoses, that are getting any form of immunotherapy, that are about to embark on immunotherapy, particularly in the setting of things like CAR T cells and allogeneic transplant, really need to invest in seeing either a functional medicine doctor or a naturopath to kind of look at them from a holistic standpoint, right? And to look at some of those root causes to try to help clean things up. So it's a long tangential response. But the other thing I want to say is, unfortunately, some medical oncologists are not aware that Tylenol can affect the immunotherapy responsiveness. Antibiotics may affect their ability to respond to an immunotherapy. And that if they're on an acid blocker, there's a plethora of data that shows that can greatly affect your ability to respond to an immunotherapy. So if you don't mind, I'd like to give you a patient example.
Go right ahead, please.
Okay. So I was covering for another physician, and I saw this very unfortunate, actually very sad man who had come to the clinic with his wife to get his second line of chemotherapy with a medicine called gemcitabine. All right. And as I looked over his records, he's 47. He's got an advanced adenocarcinoma, glandular cancer of the lung. And when I looked at we do all these fancy tests in oncology called next generation sequencing. So we look at molecular profiles to look for what are called driver mutations or targets that we can use. We also look at PD-L1 status to get us an assessment for their ability to respond to some of our immunotherapies. Well, as I looked at his profile, he had a very high PD-L1. It was 70%. Above 50% is considered high likelihood of response, high likelihood of benefit. And so as I reviewed his record, I saw that he had gotten two common drugs that we use, right? He had gotten carboplatin and Taxol with Keytruda, an immunotherapy, okay? So he had an initial improvement at 3 months, but by 6 months, his disease was already progressing, which really should not have happened, okay? So as I'm reviewing this case and I'm talking with him, and he talks how he was really devastated when he stopped responding to Keytruda so quickly, right? Because he was so excited about this because his PD-L1 was so high, and he should have gotten a lot more mileage out of this. But as I reviewed his case, he was on a proton pump blocker. So, I asked him, how long have you been on that? Oh, I've been on that for years. Why are you on it? I'm on it for reflux, which should absolutely not be happening. But he was on it for reflux. And then as I looked at his medicines, he was on Vicodin for his pain, which contains Tylenol. So he was getting lots of Tylenol. And he was, had been treated with antibiotics early on in that treatment course because of a pneumonia. And that can affect, all of those things can affect the gut microbiome, right? So as I was looking at his case, I was really struck by the importance of him having his gut examined, right? And I don't know if I can be disappointed that his treating oncologist didn't recognize all of these things, but he didn't for whatever reason, right? And so I recommended to the patient that he have his GI tract looked at. I made him aware that there's bacteria like Akkermansia that might help him recapture his immunotherapy response, that he really needed to work with his other providers to get off his proton pump blocker, as well as the Tylenol. And there are other pain medicines without Tylenol, because these could be affecting his ability to respond to immunotherapy. So I use this as an example of a real world case of a patient that I was seeing that I think had his treatment response was greatly handicapped by conventional medicines he was on, left on, and really not addressed.
What's the status of the patient today? Do you know?
Well, I don't, because I was the covering doctor. I made lots of recommendations, right? Things I just mentioned, but that doesn't mean his treating physician is going to respond to any of that. All I could do, I made the patient aware, right? Hey, these are things that you should consider. Maybe see someone to look at your GI tract. Maybe your conventional oncologist would be willing to retry that immunotherapy. But in that situation, I can't dictate, yeah, you really need to fix his gut and do this. I can only make suggestions. But I bring it up because it was a perfect example of this patient having a really poor response that I think was greatly limited and handicapped by those conventional medicines.
You said a lot in that segment there, and you answered a question that I was going to ask about how to improve the gut health or the gut microbiome. And I just want to recap for everybody that's listening to this. So the first thing that you said was food, to put good food into your belly, vitamin D plus K2, magnesium. This is low hanging fruit. in order to balance out the gut microbiome. But there are some things that if you're getting some type of immunotherapy, if you're taking maybe Tylenol, antibiotic, acid blockers like a proton, you
Pump
know,
inhibitor.
pump inhibitor, that may just undermine the whole thing. And unfortunately, your conventional oncologist, he's handcuffed or she's handcuffed by following guidelines that they must follow, which is why it's going to be a 10-minute appointment, right? At best, we're not going to ever discuss these things, unfortunately. Patient's going to have to go outside of that office, maybe look for a functional medical doctor that can maybe provide some more solutions or some possibilities. The case that you just brought up of this 47-year-old patient, you don't know what the outcome is, but as a oncologist that was assisting in the case, you're only able to make recommendations. You can't take over the patient's case. And I think that's an important thing for every patient to hear that's listening to this. Hey, I had another doctor say this, and why don't you do this? But well, that's because you're already assigned to a doctor that is responsible for your case. I think that's really important for patients to hear, that they may need to independently start investigating other physicians. So is that a fair summary there of everything that you just said?
Yeah, I think so. I would like to just reinforce a couple things. I always tell patients my job is to advise and educate. Their job is to decide what they want to do with that.
Okay.
I would reinforce it is important, and I can't understate this enough. It is important for patients to be their own advocates, to research things, and to question information and guidance. We have to realize that oncologist is only going to be following very limited guidelines. The box is really small. If they're going to really want to think outside the box, try to augment immune system, taper themselves off things, get to root causes, they're probably going to have to see someone who actually can help navigate that. The other couple things I wanted to bring up is, so when we say proton pump inhibitor, so I'm talking about any acid blocker. So that can include some of the what are called histamine 2 blockers. So I'm going to use some examples. Omeprazole, which is Prilosec, Nexium, could be pantoprazole or Protonix, the Pepsids, the famotidines, those type of medicines are band-aids and are not really getting to the root cause. So this is a big issue, right? These medicines were really designed to kind of treat ulcers. You're on it for a short period of time and you're off, okay?
Sure.
Now people end up on these medicines for decades because of reflux, but nobody's getting into what's the cause of your reflux, okay?
Mm.
So let's just talk about that a second, all right? By the time you're age 50, your stomach acid greatly reduces, okay? It's 20 to 50% of the population. So this is ginormous. This was one of my problems, which I didn't know about till I knew about it, okay? So that's called hypochlorhydria. You just don't have enough stomach acid. And in some people, what they don't realize is because their stomach, so the pH of the stomach should be somewhere around 2 or a little bit less when you're eating, to help digest food, to help activate pepsin to break down the protein. So what happens is if the pH of that stomach rises, let's say it's 4 to 5, so it's still somewhat acidic, but not acidic enough, then the lower esophageal sphincter is not getting triggered to close, right? And then if the esophagus is a tube, the pH there is about 7. So if that little sphincter area is not tightening, what'll happen that the stomach contents with that pH of 4 or 5, which is not acidic enough for the stomach, not acidic enough to make that little sphincter close, if it kind of gets its way up into the esophagus, it's going to burn because the pH in the esophagus is more like 7, right? But what people don't realize, in some people, their problem is not they have too much stomach acid. Their problem is they have too little stomach acid. So to me, this is crazy, right? So their problem is they really need to be getting to the addressing the root cause of their problem, they may need a supplement to supplement stomach acid. They may have to look at some of their medicines that are low, that are also making that lower esophageal sphincter loose. And there's a host of those. But the bottom line is they need to be working with someone who can help them identify root cause issues. Now, sometimes the root cause is not that issue, but the root cause is the patient's 40 pounds overweight and they're eating foods that are going to lower that lower esophageal sphincter. And when they lie down at night, if they got a full belly, then the abdominal wall that's so heavy is going to compress, and that's just going to cause things to reflux up, right? So the bottom line is, and I want to reinforce this, proton pump blockers are not meant for long-term use. You got to work with somebody who can get you off of them. You should not abruptly stop them. You can actually get a rebound kind of hypersecretion issue. So they really have to kind of get tapered off while somebody is addressing the root cause, right? Let's figure out what else is going on in your gut, but let's get you tapered off your proton pump inhibitor and figure out what we've got to do to actually get to the root cause of your reflux and not just throw another pill on the ill pile.
So let me repeat what I just heard, because I'm in my 50s, and I just heard you say.
Robert, you would never know that.
So, but I just heard you say that as part of the aging process, that the pH is changing after the age of 50 in our acid. It's changing, and this is unfortunate because we really want a pH of 1 to 2% in the gut in order for the acid to be there to break things down properly, right?
Stomach.
Stomach,
So in the stomach, right?
Okay, so
pH of 1 to 2.
okay,
yeah.
1 to 2. But unfortunately, there are some individuals out there on some type of acid blocker, and it's because the pH has gotten it's gotten too high for, we don't know why, but it doesn't allow at the bottom of the esophagus, the little sphincter, I call it the lid that I've seen, it's not closing properly, and so acids are coming up through here, and people have this acid reflux type of thing going on. So we need to get to the bottom of that so that you can get off your acid, blockers, basically. And that brings me to is that correct, what I just said? That summary correct? I don't want to mislead anyone.
Reasonably, yes, right,
Okay.
right. So I just wanted to bring up, and I'm sorry, I'm an educator, I'm a teacher by heart, right?
Yes.
And for me, things have to make sense, and it's one of the reasons that I try to explain this to patients also. But I get back to the way God made us is the way we're supposed to be, right? You're supposed to have acid in your stomach. And I tell all my patients that if they're on these acid blocking medicines, their GI tract is jacked up from the stomach down. It really is. It's all messed up. Whether they know it or not, this medicine that's maybe making their reflux feel a little bit less so they can eat, chili at night, is actually causing so much harm. It's actually devastating. So let me just explain. So you need an acidic chyme, right, to activate your pepsin, to break down that food bolus that's in your stomach. So when it goes into the small intestines, the next phase of digestion, that chyme's got to be acidic enough to trigger release of bile and pancreatic enzymes, okay? If it's not doing that, you're again having even less digestion. So now you're not digesting your proteins, your carbohydrates, your fats very well. That's causing overgrowth of bacteria, because bacteria from the colon can be kind of backwashing up in there. So you're having so much bacteria in your gut that's not supposed to be there. Your food can literally be fermenting in the gut, and that's causing bloating and gas and tummy pain after people are eating. And they have no idea that this is all coming from this low acid issue. And so this can lead to leaky gut syndrome, or we call it intestinal permeability issues. So what happens now, you have your gut borders are kind of loosened, right? And the toxins, endotoxins, and some of these big food particles are now exposed to your immune system, because 70 to 80% of your immune system lives around your gut. So now what happens is your body is starting to make antibodies against these big food proteins that are cross-reacting with multiple tissues, okay? So perfect example is Hashimoto's. People don't recognize this, but a significant cause of Hashimoto's thyroiditis is gluten. The gluten antibody, the gluten has what's called molecular mimicry. It shares some common sequences with your thyroid tissue. So people will start to develop an antibody against this gluten particle that their gut's seen, and then that antibody that's made is traveling up to the thyroid and starts to destroy it, okay? So it's literally from the gut. There's a gut thyroid connection, okay? But the other part of this, it goes on from there. So these cross-reactive proteins that are being developed because of all this malabsorbed food that's in your gut, as well as some of the toxins from the bacteria is getting over into your bloodstream. And now you don't realize, because you've been on your proton pump inhibitor for 3 years, now you got psoriasis and you're seeing the rheumatologist. You don't realize your psoriasis is really coming from your gut. You're seeing the endocrinologist because you have Hashimoto's thyroiditis, and you don't realize your Hashimoto's is coming from your gut. And now you're seeing the psychiatrist because you're terribly depressed and you're anxious and you can't sleep at night and you're having panic attacks and you have no idea it's because it's coming from your gut, right? So people are seeing all of these conventional medicine doctors, and again, it's who's getting to the root cause. When the root cause is really coming from their downstream gut effects from their proton pump inhibitor, their omeprazole, or medicines like it for the last 10 years. Do you understand what I'm saying here?
Yeah, perfectly. I understand it perfectly, and it's deeply disturbing.
It should be. It
It's
should be
disturbing.
deeply disturbing.
Um, yeah,
Yeah.
One other question regarding this, because again, this is all happening in our gut, and it frustrates me because we have so many young people, children that are eating trash. It's just trash. It's coming out of a box. And you know, the we have an obesity epidemic in this country, and people are bloated with all kinds of things, right? And much of this is happening in one respect because we just don't know better, right? Our healthcare system isn't set up to help people in the right kind of way. But I digress. I want to go back to something because of the acids and things being out of balance in the gut. Everything that you just said, there's one thing you didn't say, but I want to ask, is this also going to be is this also going to result in my bad constipation? I can't go to the bathroom. I
It
can't
is,
go
yeah, it's part of it, right? It's
part of it.
part
Okay.
of it.
Okay.
So people are, if you're eating a commercial diet, right? We know that this is toxins, right? And I believe that we're in a disease management system, not a healthcare system. If we were in a healthcare system, your doctor would be taught to get to the root cause of your issue and not put you on a pill that causes another problem, that causes another problem, that causes another problem, right?
Right.
So I think it's important for us to recognize that everybody has to take personal responsibility, and we have got to get back to the basics. They have made it way too easy for us to poison themselves, right? So we've got to get back to having our own garden. I will tell you, Dr. Jamie has chickens. Proudly has, I love it, right? They get me outside. I get organic eggs. I have a garden, right? I learned how to pressure can 2 years ago. I am so proud of that. I jokingly tell patients I finally became a woman, right? Well, I used to, no, I was in the, the crowd on the standard American diet for years. I used to think cooking for my family was telling my husband which Stouffer's to put in the oven that night, right? So when I woke up during COVID, I woke up hard, right? I woke up across the board, and frankly, I praise God for it. But during that time, all of my food is home cooked, right? My husband is the sous chef. We're doing organic. I've got 2 crock pots going. I'm freezing in Pyrex, right? We're doing everything we can to turn down the toxic spigot. So I do practice what I preach. And I just want to go back to your brief sidebar, and I think it's an important one. Young people are getting poisoned, right? There's something called epigenetics. Epigenetics means above the genes, but it's basically our lifestyle stuff that affects which genes our body is going to translate and turn on and turn off. So if you're filling your body with plastics, right, the xenoestrogens from all the plastics we're getting drowned in, from the aluminum cans, from the toxic things in their Monster drinks, or whatever that their energy drink is, the commercial foods that they're on, the microwave that's destroying their food and is likely making it toxic. So no wonder 1/3 of young adults have mental health issues. I can guarantee you their gut is a mess as part of it. Now, there could be some other things going on there, right? A lot of people have MTHFR mutations, and there are some genetic things, but it's our lifestyle that's triggering some of that, what's getting expressed and what is not. So for oncology patients, but across the board, we all have to get back to being more self-sufficient, going to the farmers markets. I trust my neighbor more than I do big industry, right? Learning how to cook ourselves, learning how to do a little canning or food storage, right? Raising a little bit of our own food, I think, is really important for us. So if you don't want to end up with cancer, right, or a chronic health issue, I think this is hopefully this is a wake-up call to say you need to really look at your lifestyle. And you also really need to look at certain medicines you're on, like these proton pump inhibitors, that greatly cause downstream effects that could be causing other problems you're now experiencing, and you have no idea it's really coming from the gut.
Okay. Thank you. I want to be respectful of your time, and yet I want to make sure I don't leave the audience on a cliffhanger here because you've said enough. You got me to a point where it's like, okay, I need to know which test do I need to take to determine the state of my gut health today. What tests are these? Just give me a few, something. And which healthcare professionals do I go to see that could administer this kind of test? What does this look like?
So excellent question. I think you're going to have to work with somebody. This is not just a test you can order online and know what to do with it.
Okay.
I would look for an established provider in my area, and that could be a naturopath, that could be a functional medicine doctor, I think, or an integrative medicine doctor. I think you're going to be in one of those camps. You want to ask questions like, do you see patients with GI illness? Do you see patients that do have a cancering process? Not that you're asking them to treat your cancer. You're just wanting to make sure they're familiar with some of the nuances in the oncology patients. And I think you want to look for people who have a good reputation in the area. I would anticipate it would take probably 3 or 4 visits. It's going to take several visits. They're going to need to get to know your history. They're going to need to order the appropriate test, which is usually stool. It's a stool test typically. Now, I would not recommend checking for food allergies until the gut is healed, because you're going to look like you're allergic to, 20 different foods. And that's a huge red flag that you probably have leaky gut. And the problem is your immune system's being exposed to all of this malabsorbed food. And once the gut is healed, that is when you want to look for things like that, okay? But the gut needs to be addressed first, and there are different tests. There's GI Map, there's Gut Zoomer, there's Doctor's Data, Genova Diagnostics has them. So there's a host of companies. The importance is that provider has a company that they trust and they can interpret the data to use the data to help you. And many of those providers will use natural supplements, whether it's, berberine, some type of IgA or IgG supplement, probiotics. potentially some type of fiber, and some type of healing protocol. So if leaky gut's present at some point in the phase of the healing process, they're going to want to repair the gut. And so one of the things I usually recommend is, because a lot of the GI tract repairing products may have glutamine in them. So I typically avoid glutamine in a patient with an active cancering process, because some cancers can be fueled by glutamine. So that I would want that practitioner to do something. And there's lots of other products, right? With aloe vera, marshmallow root, slippery elm, and deglycerized licorice. So there's some nice healing products that don't necessarily have to have glutamine in it. Although glutamine is great for the gut, if there's a active cancering process, I'd say for our healing phase, let's do something different right now. And that's why I would want an integrative doctor that kind of has worked with oncology patients, so that they're aware of that. That doctor also should be looking at things like your vitamin D level, kind of getting you where you need to be in that regard, talking to you about lifestyle modification, how important it is, things that we talk about routinely, right? You got to be exercising 30 minutes every day. You have to get 8 hours of sleep a night. So important, because that's very anti-cancer. It's when your body detoxes and repairs. So I would want them to kind of talk about your GI tract, but maybe give you some oversight on kind of the whole package, because anything that's making you sick is making your gut microbiome sick. And we know things like inflammation, wherever it's coming from, will fuel a cancering process. So again, it's getting to those roots.
Okay. I want to determine my current state of my gut, the health of my gut. I'm going to either go see a naturopath, a functional medical doctor, maybe some integrative oncologist. And if I'm diagnosed with cancer, preferably someone that's comfortable seeing cancer patients. They understand the nomenclature, the terminology of the field itself. And more often than not, these type of tests are going to be some type of a stool test that's going to be conducted. And what's really important is, don't get carried away for testing for food allergens yet, because if your gut is not in good health, you're going to show up that you're allergic to all kinds of things. So the point of the test is to not just determine the health, but assuming it's unhealthy, let's get on a protocol to clean it up, and then later on in the future we could test for allergens, is what I heard. So, and this is going to probably be about 3 or 4 visits to the doctor the course of time, to take care of this. Is that fair?
I think so. I think
Okay.
so.
Okay. Good. Good. Thank you for all of that. And thank you for, uh, you know, getting with us today on this important topic. Just hearing you discuss it, obviously with your passion, and the fact that you are an educator, makes me take it more seriously as well. I often think that, hey, I'm taking care of my gut, but it adds that level of vigilance, right? It's like, hey, this is my best friend down here, and I want to take care of it, right? Do it well as I'm getting older, etc. So, thank you so much, Dr. Jamie. I do appreciate you sharing this wealth of wisdom with our audience. Is there anything else you would like to say at all?
I think we have really hit the highlights. I guess to wrap things kind of in a bigger picture. So I see gut microbiome as part of the terrain, right? So the body's ability to be able to withstand and to help you in your battle against cancer, but it's part of the terrain, right? So that is part of why I emphasize it's important for us to be looking at all these other issues as well, that your conventional oncologist may not have time for. And that's where I think seeing someone who can help you with things like, detoxification, some of those lifestyle modifications, what are reasonable supplements for somebody to be on just to support health, and help them in their anti-cancer process, right? So we talked about vitamin D3 and vitamin K2 as examples. And there are others, right, that again are low-hanging fruit. But I think talking and working with a provider that can help you with a little bit of that. That doesn't mean you have to go to an integrative practice and spend $20,000 that you don't have on multiple modalities, right? There can be a rationale for maybe some vitamin C during that process. So there's some other adjuncts, but I think the real focus, at least as we talk about this, is really to stress the importance of looking at that gut microbiome. If immunotherapy is going to be a part of your treatment strategy, and the importance cannot be understated, and your oncologist is probably not the one that's going to be able to have that conversation with you, I can almost guarantee it.
All right, thank you. And for anybody that's watching this and wants to look up Dr. Jamie, her website can be found at CIOF as in Frank, M as in Mary.com. Is that correct, Dr. Jamie?
.org.
.org, I'm sorry. .org. And she's out in Cincinnati, Ohio. But you can look her up, and she's got a great website, a lot of free educational material on the website as well.
Yes.
If you bounce around there. Thanks again, Dr. Waselenko. I appreciate it.
It's a pleasure.
All right. Take care.
Thank you.
God bless
Bless
him.